Dr. Quinn, students across the Jackson Metro are now back in school for in-person learning. This comes as COVID cases are rising. Should parents be concerned?
I think parents should be concerned. As a matter of fact, I know parents should be concerned, but here's the deal. This has striked a great deal of debate, a lot of warranted concern, because there are two sides you have to look at. But at the end of the day, do the benefits outweigh the risk? Now, the risks are children can contract coronavirus. Right now, the hospitalizations are up for pediatric hospitalizations. Children are getting sick, but children are getting vaccinated, and we just need to get more children vaccinated, because the more children we get vaccinated, the less likely your child will get sick. But on the other side, children not doing in-person learning, children that are doing virtual learning at home, the data is in, and it's very clearly demonstrating that these children are not getting the educational benefits that they were in the classroom. A lot of children are being left behind. But not only that, there's a higher rate of depression, anxiety, even suicide in some of our adolescent children. But then you also have to look at the fact that a lot of children depend on school for social development and social support. They also depend on school for a lot of cases for meals, because some children are in situations where meals are not as readily available, especially well-balanced meals that they receive at school. So there are a lot of benefits for in-person school versus the disadvantages of school virtually. And right now, the experts are determining that the benefits outweigh the risk.
And what can parents do to increase the safety of their children who are going to school for in-person learning?
Well, the most important thing, and the measure that parents can take for their children, is to get their children vaccinated if they have not already done so. And we also have some really good news. The FDA and the CDC have both signed off. So children as young as 12 years of age can now get booster vaccinations, and they can do it at 5 months as opposed to 6 months, which was the previous interval. And the data has overwhelmingly demonstrated getting those booster vaccinations raise your immune system defenses so high, if you do contract coronavirus, you have such a good chance of just fighting it off and really having a good course and not ending up getting very sick, getting hospitalized, and or losing your life. So now we have a new weapon that we can really fight this coronavirus pandemic.
And we're learning more about cloth masks. Apparently they're not as effective. So should kids or students just toss the cloth masks and get better masks for better protection?
Right now, there's debate as far as, which mask children should use. But the take home is any type of measures are better than none at all. So right now, the schools are really, really pushing for children to wear those masks. And I just want to give you a patient I had came in. She was really upset. Her child went to school with a Superman mask on and came home with a Batman mask, and she was so upset. So tell them to wear their mask all day, the same mask that they left home with.
All right, Dr. Quinn, thank you so much.